Something that comes up, I think, a lot is just hormones, in general,
Mhm.
hormones. What are my hormone levels? Should I be checking my hormone levels? Are hormones bad at a certain age, whether you're an adolescent who is suffering and missing school because your periods are so miserable, to those who are peri and menopausal? The hormones are just the topic of conversation a lot. What is your experience with people asking about hormones, and what should we be doing when people say, I think I need to check my hormones before I start any sort of medication that involves hormones?
The first thing I do when someone asks me that question, I always ask, like, oh, tell me a little bit more about where that's coming from. What is the motivation a person has when they're asking about hormones? Because there's probably a reason, right? Maybe they're suffering from menopausal symptoms. Maybe they are having occasional hot flashes. Maybe there are a number of different reasons, or maybe they're having other like vaginal symptoms. And so one of the things that like our patients often present to us is asking the question should prompt us to ask more questions, because a lot of the times, we know as providers that checking hormones isn't usually the answer, because hormones do fluctuate, and hormones fluctuate based on the time of day, based on what you had, how you're feeling, if someone is stressed. And really it's the clinical picture and scenario is that really drives our care. And so asking our patients, like, what are they feeling? And then reassuring them, checking that the hormones really probably won't do too much. There are some situations in which checking hormones are helpful, but for a general provider providing routine spectrum care, that's usually not something that we're doing. I think the only instances when I check hormones, if I'm worried about someone not having periods and they're supposed to. But there's also a different kind of workup for that, right? Like, are they pregnant? Are they, some of those other labs and, clinical picture is more important than the actual hormones.
Those are great points because I think, again, the intention or the worry is sometimes lost in the advocacy for this is what, Dr. Google or ChatGPT or something told me that I need to do, when really as clinicians, we should be asking ourselves, will this information change our management? And I think in the case of hormones, short of these exceptions, particularly when we're thinking about how hormones interplay with contraception as the goal, it's just a poke from your vein that is not going to change our management in most situations. And so I think clarifying what the worries are for the patient, for the guardian, if they're with the patient, if they're younger, or the adult child who is with their parent, is definitely a good starting point to just like get on the same page, because some of these worries are so big, but actually are nothing more than just worries. And we can actually provide some good help without doing a blood draw.
Yeah, sometimes we really just need to kind of dig into like what are the reasons, what are the worries, what can we help? And a lot of times we can do a lot of help without doing these unnecessary procedures.